Thanks for joining me on Facebook Live. Now 2 weeks ago we talked about botulinum toxin and talked about the ins and outs of that. And now this week we're going to talk about dermal fillers. I think probably dermal fillers, there is even more misconceptions about dermal fillers and more fears. And that's what I'd like to talk to you about today. Now in the media, I find that you'll see the disasters in the media. You'll see the person with the crazy overdone lips and the massive big cheeks looking like a freak. Now I can understand that. I mean, there's not a lot interesting to talk about in something that's well done. But that is not good filler. Filler should not look like that. Filler is so much more than that. The way that we do filler at Skin Institute is to keep you looking like you. And the way that we use it is not just in the cheeks and just in the lips. We use it in places to subtly enhance the face, to take away your face looking saggy, or your face looking tired, or your face looking sad. But it's not about changing how you look. It's about you looking exactly like you, but just a little refreshed. And the way that we do it is that we don't put it all in the lips and the cheeks. We put it in places that you wouldn't expect to get that kind of a result, a more subtle result. So what you're seeing in the media is totally not the reality of what happens in clinics. So the sorts of things that we can do is we can put some filler in to support the mouth, or we can put some filler in to pull back and reduce the jowls, or we can put some filler in to slightly reduce the hollows under your eyes. And those are the sorts of things that we can do rather than making your lips big or making your cheeks big. I mean, we can even make your chin more projected if you feel that your chin is a little too short. So there's a whole lot of things that we can do. And if I could just perhaps show you on a face the sorts of things that we can do with filler and where we might put it. If I can just get, come over here. This is Emma. She is a nurse at Skin Institute. Coming forward this way. I just want to make sure, can everybody see? Now, the sort of thing that we can do is, it's really unexpected where we put filler. You'll find that if you put filler up and through here, it can actually lift up and improve the under eye area. Or if you put filler back and through here with the cheek, it can actually lift back, or even under back here, you can put it here and it will actually tighten up the jowl area. And if we combine that filler with these certain key areas in the face, you'll find that you get a very subtle and natural type of rejuvenation, rather than the like boom, massive lips, massive cheeks look that you might see in the media, which is totally not how I would like to see filler done. Thank you, Emma.
That's okay.
So the other thing that people are often concerned about is, I don't want my face to change too much. I don't want people to know I've had it done. And we find that the best way to do it is if you have gradual treatments, little by little. So we can just do a little at a time, gradually, over even 2 to 3 years, to the point where rather than changing, it's almost like you'll stay the same. So instead of your face continuing to age, it will be supported in key areas so that it doesn't change over the years. So you can stay looking like you rather than seeing these aging changes. And so this little and often gradual approach is something that a lot of clients like, because people don't notice that they're having anything done. No one's thinking, oh, have they had something done? Which is, most of us want to keep this sort of thing private. Now, slightly different is what the younger clients want. They are often looking for a bigger lip or a more dramatic look. But once again, it is really important to keep things looking natural. And that is where proportion comes in. The proportion of the lips to the eyes and the proportion of the upper lip to the lower lip is incredibly important at making the results look natural. So you do need to be going to a practitioner that has good training in dermal fillers and has good training in assessing the face and determining what is right for your face. So, what should you be asking when you're going to have fillers? What your filler is made of is really important. And the filler that is the most used worldwide is filler made from hyaluronan. Now, most of the major brands that you've heard of are made from hyaluronan. Hyaluronan is a carbohydrate, and it's naturally present in our skin, in our joints, in our eyes. When it was first isolated, it was back in 1930s, it was first isolated, and it was actually first isolated out of cow's eyes. And the guy who first discovered it or isolated it actually put a patent on it to be used as an egg white substitute in cooking. So it is a molecule that is naturally present in our bodies. We have enzymes that break it down. It's something that our bodies are used to. And dermal fillers made from hyaluronan are the safest form of dermal filler that you can get. You'll find that hyaluronan is an ingredient in a lot of moisturizers these days, and that's because it really hydrates, it really sucks the water into it. And so you'll find that not only can we recontour the face with dermal filler, we can also improve the condition of the skin. And clinical studies have shown us that it will increase your collagen formation and it will help hydrate your skin. So it has a number of benefits on the skin itself as well as recontouring the face. Just because I've mentioned contouring, I'd like to just say a little bit about that. The trend for using makeup to contour your face and forming some shadows under here and maybe highlighting down the nose and sculpting the face with the use of shadows and highlights. That's really what dermal filler does. Except rather than make a shadow by using makeup, we're actually using the filler to recontour the face itself to form new highlights and new shadows in the face. So filler, rather than relaxing a muscle like botulinum toxin does, filler actually recontours to do the restoration work that it does to make your face look less saggy or to support the corners of your mouth or to project your chin out, those sorts of things. Now, just going back to hyaluronan, which is what filler is made of, the reason that I would recommend that you check that your dermal filler is made from hyaluronan is it gives you an extra level of safety. And that's because hyaluronan is dissolvable. And in fact, the enzyme for dissolving hyaluronan fillers was around before we actually got the fillers. And so you can actually get in a little vial an enzyme that we can inject in, and actually it will dissolve the filler within a couple of hours. So that gives you a level of safety with hyaluronan dermal fillers that I believe is hard to match. And I think it's a large part with why these fillers have become so popular these days. The other thing to talk about with dermal filler is the way that people can come in and have their treatment and what they might look like afterwards. So you can expect a little bit of swelling and redness after filler, and the bruise, it is possible to get a bruise. Those are the main things that you can notice. And the bruising can be covered the day after dermal filler, but I do recommend that you don't have any really major commitments or engagements on in the week or two after the filler, because if you do have a bruise, then people do sometimes comment and wonder what you've been doing. And now just finally, I've also got some filler here so you can actually have a look at it and see what it looks like. Now, it comes in a syringe like this, and it's a clear gel. So you can see why it was first patented as an egg white substitute, because it really does look a little bit like egg white. But your own natural hyaluronan only lasts a couple of days. So the hyaluronan that you have in your skin and your eyes and in your joints, it's turned over every couple of days. But the filler in here, the dermal filler in here, is actually cross-linked to last a lot longer. So what I thought I'd do is just give you, so I'll just take the top of it. I'll just show you what it looks like. It's just clear, and you can see, I'm just going to push it so it comes out. See how it sticks together? We call that cohesivity, and it wants to stick together. So that's what we're putting in when we're putting in filler. It's this soft gel that will help lift up and contour the area, and this is a particularly soft one here that we would usually use for fine lines. You can get filler in different strengths, as it were. So you can get different concentrations of hyaluronan and different amounts of cross-linking will change the characteristics of the filler such that it can be thinner and we can use it under finer lines, or it can be thicker and we can use it instead for more of a resculpting effect, like perhaps enhancing the cheekbones, or we can project the chin, or we can do some real support in the face. Because what we're actually doing is that we are actually addressing the changes that occur in the face deep down with aging. Now, do we have some questions? How long does filler last? Can you take it out if you don't like it? Yes, you can take it out if you don't like it, like we discussed. Now, fillers these days do last a lot longer than they used to. The early days, the fillers would last about three months or so. These days, they last up to 2 years. So it's the sort of thing, this is why we can do this gradual treatment where you can build up gradually over time, a little at a time to get your transformation. And as a general rule, the thinner fillers last a shorter amount of time, the thicker fillers last longer. So a thinner filler you'd expect more to last around about 6 months. A thicker filler would last somewhere between 1 year and 2 years. And it also depends a little bit on your metabolism. People with a real fast metabolism, doing a lot of exercise, under a lot of stress, can chew through it a bit quicker, and other people can find that it lasts a lot longer. Just going to have a look at any other questions. What's the best age to get fillers? Now, this is really interesting because there was a study done asking a number of women what the best age to get fillers was, and the general consensus was between 35 and 40 as being the best age to get fillers. And this is really interesting because this is when our hormonal changes start to make fat and bone changes in our face. This is when our cute little wrinkles start to turn into stag and looking tired, and that is what fillers can help. Fillers can help this deeper fat and bone loss that starts to happen when we are more heading into our 35 to 40 age group. Now I'm just going to have to put my password back into the laptop to see my next question. I think there's some more. I'd really like to answer your questions, so do shoot them through if you've got any. Can fillers help close large pores on your skin? Now that is a really interesting question because I have noticed immediately after doing a cheek enhancement, the side that is treated, the pores look smaller and it seems to reflect light better. Now, I can't quite explain that. There's a few of us who've talked about this, a few of us practitioners have talked about this together and said, what is happening here? And I'm not sure if there is an immediate hydration effect that's making those pores look smaller, or whether it's the actual support from underneath that is helping the structure of the skin. Now, this is completely unscientific. This is all something that we have anecdotally noticed. There's no scientific basis for what I'm saying, but I have absolutely noticed this, and I'm not sure why it occurs, but it is something that I have noticed, that the pores do seem to look smaller in an area where the skin has been treated with fillers. Now we're going to finish. Any questions that I didn't get to, we'll be able to actually write down and do. But if you would like to know a little bit more about it, I have a downloadable 2-page ebook called Uncovering Injectables. That's on www.skininstitute.co.nz and then /injectables. And that's got more information about dermal filler on it, with some top tips, how to find a good practitioner, that sort of thing. So please do go download that for a little bit more information. Thanks for joining me today. I really enjoyed it.